Good afternoon. Thank you for joining us. I'm Nicole Brambilla, the health and wellness reporter for LNP Lancaster Online, and we're downtown in our studio today with John Herman. He's the new CEO of Penn Medicine, Lancaster General Health. Welcome to the studio.
Thank you. It's nice to be here.
Yeah, good to have you here. So you took the helm March 1st. We had reached out to you about doing a sit down, and now you've got kind of your feet wet. Just give us your first impressions of Lancaster and the hospital since you've been here.
Yeah, I think the thing that's most profound is the true love of and from the community. I think a lot of communities talk about they love their hospital, or hospitals say they love, but it's real here. I mean, we talk about it every single day of how we are focused on living our mission of serving the community. And so whether it's through our lead program or our food initiatives or supporting a philanthropic organization, that's really been a unique part of the experience, and really I think is a tribute to the community. I think that's why the community is doing so well.
Now, not to take away from that statement, we are in the middle of a crisis, a healthcare crisis with the COVID-19 pandemic. Do you think that that also, given that LGH has been at the forefront, we don't have a public health department here, but LGH has been at the forefront in the fight against COVID. Do you think some of that sentiment has helped buoy that, or can you tell only 3 months in?
I can't tell the before, but I mean, I think it's natural. I think from the work that needed to get done to help the community get through COVID, whether it's doing the testing that was done initially, whether it's contact tracing, whether it's the vaccination center that we've taken the lead on. I think that's all been part of, those are just examples of what we try to do for the community. And so I think it's natural, since those were top of mind, that it would influence our positive perception.
I'm really interested, and since you're still so new in the job, you can kind of wear sort of an outsider perspective as well. I had planned to ask this later, but since we're talking about it now, I'll go ahead and ask. We do not have a local health department, and some of the data that would be readily available to us, we've had to wait on the Department of Health, and that's a whole other issue for another segment. But I'm just wondering, what you think of LGH being the de facto Department of Health in this fight. Yeah. And I don't think that's too much of a stretch to say that, or do you?
I think it's a stretch to say that, yeah. I mean, providing for public health is really, really complicated. It's comprehensive, and it's really beyond the scope of what any one health care or health-focused organization can provide. And so, while I think we've met some of the immediate needs as it relates to contact tracing for COVID and testing, it's much, much broader than that. And so, I think we'll hopefully, or I would expect that we'll continue to be a part of providing for the public health, but we're definitely not the de facto health department.
Well, I didn't mean it quite that strongly now that I'm listening to your response. But when you think of Dr. Michael Rapinski and the mass vaccination site, he really has become sort of the face of the medical response, even though we have, a couple other local health systems here. What is your take on how that came together, do you think?
Yeah, I think, Dr. Rapinski is just amazing. Yes. I think you said it well. He's been the face of the medical response, and I think it's truly been a response. Public health is a longitudinal activity. It happens over years and years and years and years, and sometimes it's almost underground. You don't see that it's happening. And so, as a physician, he was uniquely qualified in order to be able to guide us through those response activities. But again, the health department activities are much broader than that, and so I don't know that that's the best, where he is best able to serve the public.
Do you think that that the mass vaccination site out at Park City Center and the success that it's had, in full disclosure, I was vaccinated at the mass vaccination site. It's a very smooth process. It hasn't been for everybody. We've heard some of those complaints. Yeah. But for me, it was a very smooth process. Do you think that would portend for other public-private partnerships with the county and moving forward? And what might those be?
I do think it's been a great example of a public-private partnership. As I understand, that was something that was envisioned by the county, but the county recognized that they needed help, and so reached out to Lancaster General Health. It's something that that has happened historically, and as we would typically do, we stepped up and we wanted to fulfill a role that was needed. But with just Lancaster General Health, we wouldn't have been able to do what we did. I mean, we had partners with the other health systems, we had partners with Rocklidditz, we had partners with a staffing agency. It really took for a community effort in order to pull something like that off, which was really, I think could easily be said, if it's not the best in the region, may even be beyond that in terms of other parts of the country are looking at what we're doing and trying to understand how that was put together.
Coming from Louisiana, you were at Ochsner Health.
Ochsner, yep.
Thank you for helping me pronounce that. I was kind of curious to know what made Lancaster County and LGH in particular attractive to you.
Yeah, I think to have an opportunity to work with, a community health system like Lancaster General that has this legacy, regional, nationally renowned in terms of the quality, and have the opportunity to help them and our teammates with Penn Medicine that is, if not nationally, if not internationally, then nationally renowned in terms of the innovation of the technology that they're able to bring to healthcare overall, and bring that together to the local community and to local citizens. I love a challenge, and that's one of those challenges. It's not only fulfilling, but it's really why I think many of us got into healthcare. Is how do we advance in an exceptional way? How do we advance the healthcare that we're able to offer to our local citizens? And so, those two things together, Lancaster General Health, an exceptional community hospital, and Penn Medicine, an internationally or nationally renowned innovative center, bringing those two things together at Lancaster was a difficult decision, just because I love Louisiana and New Orleans, but it made it clear that this was the right next step for me.
Were there some challenges because you did it in the middle of a pandemic?
Well, absolutely. No in-person interviews. That is difficult. But at the end of the day, I don't pick, and I don't think most of us pick an employer because of the physical setting. We pick an employer because, or a group that we're going to work with, because of the people that we meet and the relationships that we have. And I think we've all learned how to develop relationships over Zoom or Blue Jeans or whatever the technology is over the last months. And the thing that was really profound was the consistency of the passion of every single person that I spoke to about delivering exceptional health and love of the community. And so when it got to the point that I had that offer and we thought about the opportunity, it became pretty apparent. But it was difficult. I mean, I think most of us throughout all of our lives have had the opportunity to sit down like this and see people and see how they react to what you're doing, and
meet other people in the company.
We weren't able to do that, and so that by far was the hardest part, was not having that personal connection, that personal touch that we're all used to.
I was hoping you could talk a little bit about morale in the hospital when you're having these multiple waves that we've had. And some of them have been very critical in terms of the number of ICU beds that were remaining, which tends to be one of the markers that we look at in media. How are staff doing? How are people coping?
Yeah, I would say they're exhausted. And this is a team that just over and over again, when the bell rings, they run toward it. And we can't thank our nurses and our physicians and our technicians and our housekeepers and everybody that works in the health system enough. It's just, this has just been the most difficult thing that any of us in healthcare have ever gone through, not only because of the intensity of the work, but because of the mortality that our teams have seen.
Sure, and I'm sure it's touching people that, these are our community members that are coming in.
That's what I was going to say, and in many cases, it's somebody that they know has known. And I think we've had over 350 patients that have succumbed to the illness, and we're not used to that. We're not used to that as healthcare workers. So everyone is just drained by this. You know, I think that's I think the importance of some of the new technologies. I remember when monoclonal antibody came out, and it was one of those next tools that was going to become available. That it's just sort of the team started to see that there was a light at the end of the tunnel, and it lifted them up a little bit. And the same for the vaccine. And you know, now that we're starting to get to the point where if you're vaccinated, you don't have to wear a mask. You know, I mean, all those things are signs that we're nearing the end. And I think that's what everyone is looking for, is that hope. That hope that, you know, things are going to get back to a new normal, whatever that normal is. And so every single day we thank our teams as much as we possibly can, because they've just been exceptional. And we encourage them and we support them. And, you know, we've had to ask them, and we will continue to need to ask them to do really hard things that sometimes they don't understand. But, you know, I think we've got a great team of experts. We mentioned Dr. Rybczynski before, and you know, some scientists over at Penn that they just have guided us throughout the entire process.
I know, if I could just interject, I know that there was some incentives that were put into place, some reliance on traveling nurses, some overtime, some juggling around of staff. Is that something that's happening today, or is that something that's kind of in the rearview mirror now?
No, we still have travel support staff that are in place, and we still have incentives, you know, from time to time. It really is about, you know, at the bedside, you need to have a nurse, you need to have a technician that's there. And, you know, we recognize how difficult it's been, and we need to make sure we continue to support the team by creating those financial incentives and recognizing everyone for the extra work that they're doing. So it's not as prevalent as it was during the peak of the pandemic, but it's still something that we do use from time to time. And you know, I think a couple weeks ago we were at 60 or 70 COVID patients in the house, and that was another period of time where we needed the extra staff because of the intensity of patients, and so we implemented it then.
And what is it today?
Yeah, so today I think we're below 20, and this is the first time since October of last year that we've been that low. So, you know, it creates a little relief, it creates energy, it creates a more positive perspective.
And what do you credit that to? Is it the vaccines alone, or?
No, I think it's a combination of everything. I mean, we saw a benefit early on, you know, when we were socially distancing and wearing a mask and washing our hands. And so I think it's a combination of that. I think it's a combination of the monoclonal antibody, and I think it's the vaccine. But it really seems like the vaccine is the thing that's getting us past this. And we've been talking all along that we need to get to herd immunity in order to really get to some sense of new normal. There will always be COVID. We think there will always be COVID within society.
Yeah.
But if we're at a point where the majority of us, and more than 50%, but 80, 90% of everyone in the population has antibodies, and primarily through the vaccine, because that's the only thing that is studied at this point, that we think that we can get to this new normal.
So if you're joining us, we're with John Herman. He's the new CEO of Lancaster General Health. So have you identified some priorities that you would like to tackle in your first year, the remaining 9 months?
Yeah. Well, you know, I think first we got to help the teams get past COVID. And when I say get past, it doesn't mean forget. We're going to celebrate all the good things that we've done, but we want to get back to the new normal. You know, and part of that is just restarting normal care. I think many of us have not advanced we've not gone for our annual physical, we've not gotten our screening exams. We need to do that. You know, that's an important part. We've talked about public health earlier. That's an important part of maintaining the public health.
Can you share, we were talking off camera earlier, a little bit of some of those benchmarks that you were looking at that are down?
Yeah, so our breast cancer screening and our colorectal cancer screening is down, I think, by about 10 or 15% from what it normally would be. And, you know, those are all people that, you know, we know that if you identify those cancers early, your prognosis is much, much better. And we know that sometimes those cancers grow very, very quickly. So getting your regular screening is just an important part of maintaining the health. And so, you know, we've opened up additional hours so that if people want to get in, we can get them in so they can get those screenings.
What are the long-term effects of a community where you see those kinds of declines in traditional routine care? Yeah,
so I'm going to probably misquote a study, but I think probably about 6 or 9 months in, so last fall, you know, there was a study, I think it was out of Europe, that was looking at the incidence of cancer, mostly the severity of cancer as a result of people not getting screening. I think it was it was up 1.5 or 2% higher than what they had thought was going to happen over the next 5 or 6 years, just because screenings has gone down. So
Wow,
screenings
that's
are
incredible.
absolutely critical for us to maintain our personal health and maintaining the health of the population overall.
So let's talk money. In December, I believe it was, the board met and there was some discussion about the finances of the hospital system. And I think at that time it was about 2% down. I know that there's been some pauses on care to refocus the healthcare workers towards responding to the COVID crisis. Where do we stand today?
Yeah, so the last 3 or 4 months we've been in good shape. We've been able to maintain COVID care and restart the majority of our care. So our margins are back where we traditionally have run. I think we target about 4%, so we've been right around 4% or a little bit north of 4%. You know, and again, I just give tribute to the teams. You know, they're working extra hard to make sure that we can get those patients back in. Everyone that needs to get care can possibly get care. So while we're healthy from a financial perspective, and we see a positive future in front of us.
I'm kind of curious how much telemedicine has played into what the hospital does since the pandemic and what you see it looking like in the future.
Yeah, so during the peak of COVID was absolutely critical. Many times that was the only way that you were able to see your clinic physician was through telemedicine. If you look at from the point in time that COVID started to today, about 17% of the visits have been offered through COVID. So about 250,000 visits have been offered through telemedicine. And if you probably look at a year ahead of that, it was probably 2,500. You know, I mean, it's just amazing how important COVID has been to allowing us to continue to provide care to patients. And in some cases, you know, I mean, it's gone back down to 2 or 3%, but in several cases, we're hovering around 8 or 9, and for psychiatry, it's still close to 20%. I mean, what patients have realized is they actually feel more comfortable receiving care in that manner. And from a clinician's perspective, because there's no physical exam involved, they're able to provide equal level of care. And so
that's really interesting. Do you think it has to do with the comfort from being in your home or whatever setting that the individual chooses?
We do, and we think that that's going to be a technology that can apply for other areas. So if you're somebody that has chronic disease and you have just a regular checkup that you need to have a conversation with your physician, and you can have gotten lab works and it avoids you having to get in your car and drive to the clinic and sit in there and wait for your physician and then go back home. We think that there's going to be instances like that where patients it's going to be a great way of providing access for patients for years to come.
Is that something that you think that as a system you'll evaluate once you get a chance to catch your breath?
Yeah, we still are. I mean, or we are today. I think I think we recognize that providing access for patients is one of the most important things that we can do. And as you know, there's still hesitancy of patients in order to go into public spaces and big crowds. And so we talk every week, every month about how do we continue to improve access for telemedicine services, and where is it clinically appropriate and where is it not.
So switching gears just a little bit here, I'm kind of curious, as you're aware, Lancaster General is not the only game in town. What do you foresee being one of the greatest challenges for the health system moving forward, given that there is such a choice, there is a significant choice in our county to where to get your health care?
Yeah, so I've been in markets that always has had competition. So, you know, I think the important thing for us to focus on is what we're really good at. You know, I think we've been really good at providing a great patient experience, and so we're going to double down on consumerism. We're going to make sure that that we have exceptional access, that we have a friendly environment, that the information is clear, that you're able to have a coordinated experience through all of our providers because of the comprehensiveness of our clinic network, everything from primary care and OBGYN, but to all of our specialists. And so we'll double down on that consumer experience to make sure that you know, we're winning the hearts and the loyalty of our patients as a result of that. I think the second thing that we'll focus on is, because of we're part of the Penn team, they provide us access to technology that in and of on our own we wouldn't be able to do. So you think about the proton therapy center that is being built right now over at the cancer center, or the CAR T therapies that we have over there, or the advanced neurovascular care that we're able to provide. In many cases, that's because of the Penn Medicine partnership. And so we'll continue to make sure that we take the full advantage that we can of the Penn innovation and technology, and make sure that we are able to provide it here locally. So it really comes down to, I think competition is something that at the end, it should make us better. It should make care better for patients.
That's a great segue into what I wanted to talk to next. So thank you for jumping ahead on that. There are a couple of projects. You mentioned that one there. I know that in December, the public entrance to the ER department moved. Give us a quick status update on how that project is doing. The
ER.
Yeah, but it's more than that. It's also, I think you're updating the cafeteria services.
Yeah. So the project is well underway. Most of the what we call enabling moves. So moving things to create the space that we need in order to free up the space that we need in order to create the new unit. So most of the enabling moves are done. We are in the temporary entrance, and I think, although different, is working reasonably well. We actually ended up putting an additional physician over in that entrance just to make sure that when patients came in, they received the appropriate triage. So we're in the phase of the project where we're in the ground. We're in the limestone. We're digging up the limestone, breaking it up, making sure that the foundations are in place. But we're on schedule. We will be are still on target to see our first patient in August of 2022, which seems like a long way away.
It's not that long away.
But it'll come really, really fast.
I'm kind of curious, given steel shortages and prices, building construction, how much has what's coincided with the pandemic impacted the overall cost of the project?
Yeah, so right now we have our steel, so we got steel early. It's having some impact. I think we're still waiting to see on some of the other softer building materials, drywall, plaster, flooring, cabinetry, things like that. We haven't procured those yet. So we'll work through that. I think it will definitely have an impact, but right now we're still within our overall budget for the project.
So I was hoping now that you could talk a little bit about the property. Looking over our archives earlier today, I think it's roughly 69 acres or so that LGH owns in West Earl Township at Route 22 North, just outside of Ephrata Township. I know that there was discussion about building a new medical center there, and it was a little bit controversial, I think, because of the water use and some other issues. Talk to me a little bit about where you guys are with that project.
Yeah, we're starting, I would say, a system-wide reassessment of where our bed needs are. We do have that property. I think there's some utilities that are being added to it, but we haven't made a decision yet right now if that's going to be a location that we're going to develop, and if so, how we're going to develop it overall. Healthcare is changing rapidly. We talked about telemedicine earlier. What's that going to do in terms of the number of patients that actually need a bed, need to come to the hospital? Are they going to be in an ambulatory setting? Are they not? There's surgeries like an orthopedic joint, they're able to provide in an outpatient setting. So we're going through a comprehensive review that's looking at not only the environmental factors of where care is going to be provided, what's going on, where's the population growing, where do we need to be close in order to provide great access, but also, I think what needs to be here at Duke Street, what can be provided in a local environment. And so we'll probably go through that over the next 2 or 3 months and start to get a better idea of where do we need to put the inpatient beds, where do we need to put these ambulatory facilities in order to best meet the needs of the patients.
So is it a fair assessment to say that that's something that's on the back burner for now?
I would say it's one of the assets that we're looking at as we think about this great big jigsaw puzzle that we're trying to put together.
Okay, fair enough. So off the news from last week, the memo that you sent out to employees saying that you're going to require them to get the COVID-19 vaccine.
Yep.
Very similar to the influenza vaccine. I know that when it was new, it was pretty standard practice to leave it up to staff to make that decision. Talk a little bit about how that's going to play out over the next couple of months.
Yeah. So, I think we're still in a situation that we are responding to COVID. And at the end of the day, or at the beginning of the day, our mission is to advance the health and well-being of the community that we serve. We recognize, and throughout LGH's history, we've recognized our obligation in order to provide a safe environment. And so throughout COVID, we've done everything that we possibly can to keep the patients safe and to keep our staff safe. It started off with all the PPE that we made the investment in. We added ventilation. And based on where we are today, with the information that we have available to us, the vaccine has been proven to be the best tool that we have to provide for public safety and to provide for the safety of our staff.
Just in the United States alone, I checked this with the CDC this morning. I think there's been more than 270 million doses
270 million doses that have been administered. So, our teams are really, really confident in the safety, both here at LGH and as part of Penn Medicine. And so taking our responsibility for providing for patient safety, this is what we feel is the next best thing that we can do for our patients and the next best thing that we can do for our staff.
When you think about it, it's still a pretty bold step because although I think it's the next natural step in the progression, very few hospitals have announced this so far.
I know. Yeah, Penn developed the base technology, the mRNA technology that's in the Pfizer and the Moderna vaccine. And it's been in existence for 20 some years, and so it's something that we really understand. And I think if we're going to truly live up to our mission, which is to advance the health and well-being, well then, if not us, then who? We've always taken the position that we want to lead in terms of the care that we provide, and so that we thought a lot about, was this the right thing to do? There was a lot of internal discussion, and at the end of the day, it really came down to safety. This is the best way that we think that we can provide for the safety of our patients and the safety of our staff.
And I think, if I recall correctly, the roughly 9,200 employees, roughly 70% have already been vaccinated, correct?
Yeah, 66.7% at that point in time.
2 out of every 3,
right? Sure. Yeah, and so there is a good number of our staff that have, but there's a lot that we need to provide education to. So we recognize that education is going to be a really important part of this, and providing people with information.
Yeah, can I interject here? Have you found where the hesitancy is, or sort of the foot dragging? Is it among healthcare staff, or is it staff that's at home that's working remotely anyway? Have you guys had a chance to analyze that yet?
Yeah, I think it's a lot of it is staff that are between 20 and probably 45.
Really younger.
Yeah,
interesting.
The younger parts of our workforce. And I think anything from feeling that this was rushed to worried about fertility to long-term side effects. And I think all of those things are things that are understandable, why you would be concerned about that. But when you look at vaccine development, there's a YouTube video by a physician out of CHOP. I think it's Dr. Offit. And he talks about development of vaccine over time and all of the vaccines that have been developed. And what they have found in each case is if there are going to be adverse health effects, in each case they're found in the first 6 weeks of those vaccines coming out.
I think I read that study.
And so this vaccine has been out for, and that was part of the reason why the federal government, as I understand it, didn't approve the vaccine right away. They made sure that these clinical trials ran for several months before they ultimately approved it. And we have 250 million doses in the United States, and we have 1.4 billion doses of vaccines, different types that have been administered. So
globally, sure.
The confidence level of the epidemiologists and the physician community is really, really strong that this is a safe vaccine and this is the best thing that we can do to protect our patients and the best thing that we can do to protect our staff.
What's really interesting is some of those very things that you ticked off about that it was rushed, the side effects, fertility questions, are all things that I've found that the general public has a little concern about. So that's really interesting.
Yeah.
The healthcare setting doesn't distinguish that much.
No. I mean, we're people too, I guess, is what I would say. And I think it's natural. It's natural that with change, it's something that causes concern. And that was a big part of the reason why we didn't say tomorrow everyone needs to be vaccinated. We're going to take these next few months.
September 1st, correct?
It's going to be September 1st, yeah. We're going to take these next few months and we're going to sit down with staff and we'll do it one-on-one if we need to, or in small groups. We actually have a town hall tomorrow. We're going to start those conversations. I think it's really, really important that people have an opportunity to express their concerns, to have a conversation, to understand what the benefits are, and for us, we'll work through that.
So I know that there's going to be a process by which, if folks have a medical reason to not get the vaccine, that there'll be an exemption process.
Yeah.
What's the exemption rate for influenza? Do you think it'll be similar for COVID?
I don't know what it is, honestly, but it'll probably be somewhat different, because every single vaccine can have different conditions that somebody may have that causes them to potentially have an adverse reaction. So, in the influenza vaccine, the way that the vaccine is made, if you have an allergy to eggs, it can cause you to have a reaction for influenza also. The messenger RNA vaccine isn't made the same way, and so it's hard to use that as a surrogate for the number of exceptions. We'll go through this on an individual basis. I think there'll be some guidelines that we have in terms of clinical criteria. There'll be some guidelines that we have in terms of religious beliefs and other reasons. But we're going to have to work through the process over the next weeks and months to sit down with individuals and have that conversation and understand what their concerns are, and then work through a process to evaluate whether the exception should be granted, or whether we need to still try to work towards vaccination.
And if there's not an exemption granted, then what happens to?
We don't know yet.
You don't know yet?
Yeah,
okay,
we don't know
fair
yet.
enough.
I think we're still working through that process. At the end of the day, what we hope is we're able to provide enough information that everyone decides to get vaccinated. That's the end game that we're working towards. We're going to work really, really hard every single day in order to get to that point. And our hope and plan is that we're going to get there.
So no plan B yet.
No plan B yet.
Gotcha. I think the editorial board will be happy that I asked this question. And it's come up recently because Franklin Marshall College had done a study examining this, and that's the role of the public health department. I know I'm catching you new in your role still, but I just was wondering what you think the benefits are, and is that something that LGH could get behind?
Yeah, so I think public health, I would say, is something that's important.
Sure.
I've seen many different ways that a community is able to accomplish public health, and sometimes it's through a health department, and sometimes there's no health department. So the limited information that I have is right now Lancaster County ranks relatively high across the state in terms of overall health, as you look at it from a health outcomes perspective, or at least the upper middle third. So I think there are probably some areas where we could improve, but I'm not sure if the health department is really the solution or not the solution. I just don't know. I would encourage, in the same way that we're approaching some of the other challenges that we have, is we sit down and we have a dialogue, and we look at the facts and we understand where we can improve, and then we discuss what's the best mechanism for us to be able to accomplish that. And I think, if my experience or my impression of experience is true, what this county has done is, once they've identified an opportunity, they get a coalition together.
Yes.
Whether it's the vaccination center, or whether it's for lead, or whether it's for something else. And that seems to be one of the mechanisms that we use in order to be able to get there. Sometimes coordination may be something. Maybe that's an area where we can do a little bit better job of bringing the data together so it's aggregated, or maybe there needs to be a center point of guidance that we need to get. But I think the best way to get to a solution is to sit down and have that conversation and get a consensus group together, look at the facts, and then work together to identify what the best path forward is.
I think one of the biggest drivers in it is the data. That not having a public health department, we're utterly reliant on the Pennsylvania Department of Health.
Yeah.
And if you go to their dashboard, their EDDI dashboard for data on births or any number of health markers in our community, it's an 18-month, 2-year lag.
Yeah.
So it does really pose some challenges. So you think that, recapping your response, you think that moving forward it might still just end up being these coalitions that...
I don't know. Yeah, I don't know. Yeah, I think it's something where a group should get together, and we should look at where the gaps are, and we should look at what the opportunities are, and then, a group, and I don't know who that is right now, but a group should then make a recommendation that should be made available to the public, and the public should, I think we'll hear the voice of the public.
Yes, we will. I'm Nicole Brambilla, and we've been speaking with John Herman, the new CEO at Penn Medicine, Lancaster General Health. Thanks so much for joining us this afternoon, and thank you, John, for being with us
Thank
here
you.
today.
Thank you for the opportunity. It's been my pleasure.
Yeah,
Nice meeting you.
Thank you. Nice meeting you as well.